Hi, exercise 8 deals with the joints. So this is how two bones are going to come together. Sometimes there's more than two bones involved, but there's at least two. Now, technically speaking, anatomically speaking, we call a joint an articulation. So some of these joints are immovable. Some do allow for movement so that as the bones come together, there's bending that may occur. We classify the joints or the articulations by one of two ways. They can either be classified according to the structure or by the function. If you look at the functional classification, you're looking at how much movement does this joint allow, and we have the full range. Synarthrotic joints are immovable. Amphiarthrosis is slightly movable, and then a freely movable one would be a diarthrosis. As I said, you can also classify joints according to the structure. What type of tissue is involved in that joint? What type of tissue do you find between the bones? Three main categories. You have fibrous, cartilaginous, and synovial. Fibrous joints, the bones are going to be connected by dense, regular connective tissue, and there is no joint cavity involved. Cartilaginous, as the name implies, the bones are joined by cartilage, and once again, there's no joint cavity that's found there. And then synovial joints, the bones are going to be covered by articular cartilage. The two bones or three bones involved are going to be separated by a joint cavity now. Within that joint cavity, you're going to have what we call synovial membrane. There's going to be synovial fluid to help reduce friction because there's usually a lot of movement involved there. Now we can look at each of these types of structural classifications further because there are subdivisions within them. If we look at the fibrous joints, some examples that we see are sutures. These are immovable. You've already seen those in the skull, such as the coronal suture. Syndesmosis have slightly movable. The movement is somewhat limited. This, an example, would be between the tibia and the fibula. And then gomphosis are also movable fibrous joints. The main place where we see these, and a lot of people don't think about this as a joint, but it's actually between your permanent teeth and the mandible and the maxilla. That's actually considered a joint is where the teeth are held in the bone, which of course are immovable. We hope that they stay immovable. If we look further at the cartilaginous joints, um, you have synchondrosis, which have hyaline cartilage. These are immovable. An example of this would be at the epiphyseal plate where we have growth occurring in a bone, like in a long bone. And then symphysis, fibrocartilage, slightly movable. Examples of this would be between your vertebrae, what we call the intervertebral disc, that acts like a shock absorber. The most common type of joint are your synovial joints. These are freely movable. You do have a cavity there. Now there's different types of synovial joints depending on how they come together and the type of movement that's going to be there. The six main types are plane, hinge, pivot, condylar, saddle, and ball and socket. And in this diagram, it does show examples of all six of these, what it looks like, and examples of where you actually can find some of those joints. So if you look at a synovial joint, there are several components of it. The articular cavity, just remember, articular just refers to the joint. So the articular cavity, that is that space that's between the bones that are involved with that joint, and it's going to be filled with synovial fluid. The articular cartilage, this is hyaline cartilage. It's covering the ends of the bone that are coming together in that joint. It's helping to protect the ends of the bones. You don't want bone rubbing on bone. That's going to be very, very painful. The articular capsule, this is a couple of layers. They basically are enclosing that joint cavity. The synovial fluid is a lubricant. It helps to reduce friction because you've got movement of the joints there. Ligaments, you have extracapsular ligaments. They're outside of the capsule. If they're intracapsular, they're inside the capsule. Ligaments connect bone to bone. just in terms of terminology, oftentimes people will confuse ligaments and tendons. Ligaments connect bone to bone. Tendons connect bone to muscle. So right now we're just looking at ligaments in there. The articular disc, these are pads. They're made out of fiber cartilage. They're often used to help cushion. These are commonly referred to as menisci. Bursae, these are also sacs, but they are filled with synovial fluid. They also help to reduce friction. They're usually found where a tendon is coming across the bone to keep that tendon from rubbing directly on the bone. So this is an example of a synovial joint where you can see in this diagram, you can see on the ends of the bone in this bluish color, this is the articular cartilage. Oops, go that. On this diagram with the knee, you can see a little bit better. Let me highlight my pen for you. The articular cartilage, let's see right here, it's this light blue right here that lines the bone. You do not want bone on bone. In the knee, the ACL right here, excuse me, that is showing the connecting the bone to bone. Helps limit the movement, helps hopefully keep everything oriented properly. Up at the top over here, this blue area, this is the bursae that is between that tendon and the bone, helping to cushion. Like I said, it is filled with fluid. If you have bursitis, that is inflammation of it. You have several of the bursae in there. You also have menisci. This is the synovial cavity in here that's filled with fluid. Under ideal conditions, the fluid reduces the friction, the various types of cartilage, like the articular cartilage and the menisci, keep everything moving smoothly where you're not producing any friction or very low friction, and you're certainly not having bone rub on bone. So the types of synovial joints, as I said, there are 6 main types. The gliding joints, hinge joints, pivot joints. Just go through each of these, be familiar with each of the 6 types. This does give examples of where you find them, as well as on that previous picture that had an actual picture of the skeleton where you find some of them. Ellipsoidal joints, saddle joints, ball and socket. Now, when we talk about joints, we also talk about the movements that are allowed. Now, usually when we talk about the movements, you're going to find they're in pairs because you have one type of movement and then you have the opposing or the opposite type of movement. So there's descriptions here of the movements, and then later there's a picture showing. So for some people it may help just to read, and that makes sense. Some people like to see the picture of it. So just use whatever works for you. Flexion and extension. So flexion, typically it's going to be at a hinge joint like your knee, bending the knee. Extension and flexion, you're looking at the angle of the joint, and are you decreasing that angle? Are you reducing the distance between the 2 bones, such as in flexion, or are you increasing the angle and increasing the distance between the 2 bones that are involved? The increase in the angle, increase in the distance would be extension. So, as I said, they're often pairs, and you start to see how one is the opposite of the other. Abduction and adduction. On this, you were talking about either the arm or the leg. And think if someone's standing and looking directly at you, are you moving that arm or leg away from the midline, like sideways, away from the midline, or are you bringing it back towards the midline? If you are moving, say, the arm, pulling it away from the midline of the body, that would be abduction. You're taking it away. You're abducting it. Adduction. you're adding it to, so you're moving it towards the midline. Rotation and circumduction, you're moving a bone along an axis. This is often better explained by looking at a picture of it. So on this diagram here, you can see the flexion, the extension. You can see rotation, circumduction. The circumduction on the bottom picture, the middle one down here, where circumduction, the shoulder's staying still, but down here you are moving this around. Once again, abduction, adduction, moving adduction, taking it away, adduction, you're bringing it towards, adding it towards the body. Pronation and supination, these are looking using the arm, and you're looking at the hand. How are you moving it? Look at the palm. And then with the foot, you've got inversion, eversion, dorsiflexion, and plantar flexion. So once again, pronation and supination, and then you can see on the diagrams, once again, with the foot, dorsiflexion, moving those toes up, plantar flexion, pointing it down, and how are you angling the sole of the foot? There are several different types of joint disorders. Dislocation, that's where the two bones are no longer properly aligned. You need to realign them for proper healing. Sprain is damage to a ligament. It's either torn or pulled. Strain is where you've done the damage to the muscle or the tendon. One thing also in terms of joint disorders that we do see, depending on where you end up working, you may have to deal with. As we age, oftentimes that articular cartilage tends to wear down, and through arthritis, you have less movement, you may have bone on bone, and so these are things you may see, especially with older patients. And in this diagram, it is showing you have the normal hip joint, and then you have one where the bone is, that cartilage is worn down, the bone, you have pieces of bone being exposed. If you have bone rubbing on bone, that is going to be very painful.